everybody, and thank you so much, Nick. Good afternoon, everybody, and thank you so much for joining today's webinar on mental health at work, which will be presented by Professor Neil Greenberg, who is an internationally known psychiatrist and a pioneer in the world of occupational psychiatry. We are absolutely fortunate to have Neil in the specialty. Many thanks, Neil. Back to you, please.
Thank you very much. It's a very kind introduction. Right, I'll just do the screen sharing thing. Show all windows. There it is. Okay, so hopefully, can you see that? Okay, is that good?
Right.
Okay,
it's coming up. Yeah, it's there now. Yes.
Great. Okay. So thanks very much for coming and listening to this. So I know we've got about an hour. My intention is to speak for, I reckon, about 40 to 45 minutes, and that will leave some time for questions. So please put your questions in the chat or sit on them until the end, and then you can put hands up, and I'll happily do some questions. I've had a bit of introductions. Thanks very much. So I'm a psychiatrist, ex-military, based at King's College London. There's my Twitter handle if you're into Twitter, and also rather lovely, really. I'm the president-elect of SOM, so I will get to take over from Lauren Ray in well next year at some point, which is looking good. I'm looking forward to that. I do lots of things to do with mental health at work, and what I want to do today is to sort of cover, in very sort of broad sense, mental health in the workplace. If you read the newspapers, and most of them, as you know, are pretty terrible, the general view is rather pessimistic, and most of the conversations are either about mental health being badly affected by work, or more recently, you probably have seen some of the information come out about mental health interventions and them not really working and being a bit of a waste of time, which is somewhat true. We can discuss that perhaps later. But overall, we know that work is actually generally pretty good for you. And, you can go right back to the time of Galen in the year 129, which I like it, is employment is nature's physician and is essential to human happiness. And I think, although we might argue that a little bit today, I think that's still very true. And for most of us, it provides lots of things in terms of, finance and social life and meaning and self-esteem and all those sort of other things. But there's no doubt that for some, and probably, estimates about 10%, it's not good for them. And that might be because of the stresses at work. It might be because of their home life. And there's no doubt that what we would call a toxic workplace exists. And mostly in my experience of having seen lots of people who are working who have mental health difficulties, it's often a management issue that leads people into that sort of situation. This is an old Public Health England infographic, and we know, though, and this is still true, that probably 1 in 6 people have a mental health condition at any one time. And so the real reality is that lots of people at work have mental health difficulties. Probably most of them aren't extremely severe, but in any workplace, you're highly likely to have people who are not functioning at a particularly fantastic level much of the time. And I think the key point here is to think about poor mental health means poor workplace function, and poor workplace means poor mental health. It's what we call a bi-directional relationship. And this is not just about the UK. There are lots of sort of pictures here and graphics. This is really a sort of worldwide problem. And the fact is that mental ill health is pretty common. Most people do have good mental health, but there's a significant minority that don't. And the key point to note is that if you're expecting a workplace to have lots of mentally healthy people and everyone to be in a perfect state of mental health, then you're cruising for a bruising. It's not going to happen. We have to take account of the fact that many people at work will have mental health difficulties, and that's not just in the UK. This is from the Labour Force survey that you'll probably see, and from time to time, it comes out every year. It came out quite recently. These are the numbers of people, or proportions of people per 100,000 who report poor mental health. So this is self-reported. And what you can see here is it's generally between 2001 and sort of 2000 or so. It's tootling along, maybe a slight increase. And there really has been a bit of a sea change in over the last sort of 5 years in terms of an increase in self-reported poor mental health. Just out of interest, these gaps are because there was no data collected on those particular years. And the question I always get asked is this a real increase in poor mental health, or is this just people being more willing to talk about it? So this is a study called the Adult Psychiatric Morbidity Study. This is a very good study. It's interview-based, and it's done roughly every 7 years. And these are people who are using the clinical interview schedule revised, which is a diagnostic interview schedule. So it's not just self-report. These are the percentage of people who report having a significant, severe mental health problem. So they aren't people who are probably moderately depressed. These are probably severely depressed, or they got severe OCD, or they got very significant autism spectrum disorder. So these are significant problems. And what you can see here is there has been a gradual increase over the years in the rate of real diagnosable severe mental health problems. So that probably says that some of this increase is real, and some of it is probably people feeling more happy to talk about the mental health problems that they were having before. Evidence seems to suggest that the larger the organization is, the more likely you are to report stress, depression, or anxiety. So if you're in a big organization, watch out. And also, the people who are most at risk are people in professional occupations. Yeah, and hopefully, most of you will have an idea of what professional means. It tends to be, using one's intellect. And I like the definition of a professional, which is that it's someone who exercises judgment in the face of uncertainty on behalf of others, which I'm not entirely sure is the definition that's used here, but it's professional rather than manual workers who have the worst rates of self-reported poor mental health. And this is quite old now, from 2008. This is from the Black report, Dame Carol Black, who I'm sure many of you will know. And the reason I like this slide is it talks about work-related illnesses by different industries. And you can see here that actually mental ill health occurs in lots of industries, but it doesn't seem to occur in hair and beauty workers, two topics I clearly don't know very much about. And I'm not suggesting that everyone should become a hairdresser or a beautician, but it is worth thinking just for a second about why it might be that hair and beauty workers don't tend to report poor mental health, or at least not very commonly. And there probably is something about the job being quite satisfying, about people talking quite a lot of the time and seeming to help in lots of ways. And also it's got an element of skill about it. So I like this slide just because what it says is it's not inevitable that if you go to work, you will suffer with mental health difficulties. Now, in terms of the sources of stress at work, we often think about sort of the HSE type domains and work-related stress, demands, control, support, and the like. There are a large number of organizations that have trauma-related stress, child social workers, lots of healthcare workers, emergency services. And then we mustn't forget that actually a lot of stress that people experience actually comes from home. Financial difficulties, relationship, children. And someone's mental health at work can be a function of all three of these things, not just related to this. And even in people who work in, say, the emergency services, actually, the biggest reason that people have mental health difficulties at work is not traumatic stress, not for military personnel, not for police. It's the same things that affect you whether you're working in Southwark Library or whether you're working in front of a war zone. So what are common mental health disorders? And the very first thing I want to sort of draw out is that people often talk about common mental health disorders as being anxiety and depression. And it's important to note that anxiety is not a mental health disorder. Anxiety can be a mental health symptom, but it can also be completely and utterly adaptive. So you're about to go up on stage to give a big talk in front of lots of people on a topic that you haven't spoken on before. You are highly likely to be anxious. It does not mean you have a mental health problem. So we must be very careful not to label anxiety by itself as being a disorder. So what is an anxiety disorder? Well, it's a disorder when it's more than normal anxiety. What does normal anxiety mean? It means something that a clinician would judge as being within the spectrum of normal human existence. But importantly, it interferes with everyday function. So when you can't go up on stage to give the talk because you can't catch your breath and your vision's closing in and you're having a panic attack, that's when it changes from being normal anxiety into perhaps being a disorder. And normally, for most disorders, in order to be diagnosable, it has to last for weeks rather than days. And there's lots of different types of sort of disorders like this, which include phobias, simple phobias like I don't like spiders, I don't like heights, obsessive compulsive disorder, agoraphobia, which is fear of being in crowded spaces, so often on public transport, in supermarkets and the like, and generalized anxiety disorder, which affects about 6 to 7% of the population. So it's pretty common. I won't go into the specifics of each individual disorder, but what I will say is if any of you don't use ICD-11, so ICD, the International Classification of Diseases, Volume 11, it has an extremely good tool online that you can put into the search engine, the ICD-11 search engine, generalized anxiety disorder, and it will bring up a large list or a large description, tell you about the symptoms, and underneath it, it will also give you a big description about where the boundaries are between normality and disorder. So it's an incredibly useful tool that if you're not sure whether someone's got a phobia or they're just a bit scared, look up simple phobia on ICD-11 and it's really useful. These sorts of disorders create severe feelings of tension, agitation. Panic attacks, you may well have seen them. If you don't, they're very common in healthcare settings because they manifest as physical ill health, often turn up to A&E departments. And it's perhaps a funny way of thinking about it, but anxiety disorders can be infectious. They can, have you checked this? Did you check that? Or are you sure you did it right? It can make other people feel anxious at all as well. And it can cause people at work to feel irritated with people because they're constantly checking when actually they just want to get on with their own work. So depression is more than feeling sad. It's a disorder when it lasts for more than 2 weeks. And you'll see in psychiatry, we often use the 2 week, it's not all the time, but 2 weeks is quite commonly the time period. And again, it affects day-to-day function. There are 2 key symptoms that you have to have at least one of them, which is persistent low mood or persistent lack of enjoyment. So a really good question is, what was the last thing you enjoyed doing? And if someone goes, do you know, I think about 3 years ago, I remember walking up this mountain and it was really nice. That's a good sign. But when someone says, oh, I quite enjoyed my kids coming around last week, they're unlikely to have depression. So it's one of those 2 symptoms, plus a whole range of other symptoms, such as tiredness and concentration and sex drive and worthlessness. And importantly, as I'm sure you know, it's a risk factor for self-harm and suicide. And this is particularly true when people get to a hopeless situation. So one of the good ways of asking about suicide risk, and you probably know, I'm sure, but we should never be afraid of asking about suicide risk. There is no evidence at all that by you saying to someone, have you thought about ending your life, that you're likely to make them go and end their life. But what we always talk about is a forward focus. So when you're talking to them and they say, I see no point in going on, well, what are you going to do next week? I don't think there's anything I'm going to do next week. There's no point. There's no one who can help me. There's nothing. That's worrying. When they're telling you that actually, next week they're looking forward to going to the cinema and that their daughter's coming around in 2 weeks' time, that sort of forward focus is a good reassuring way that people are less likely to die by suicide. Adjustment disorders, these are incredibly common. Most people have had adjustment disorders. This describes an exaggeration of a normal reaction to a significant stressor. So that's a partner leaving you, that's not getting a promotion, that's being stopped by the police and being breathalyzed, whether you're drunk driving or not. But anything that is really stressful for you, can have the potential to impact upon you and lead you to have disturbances of your thoughts, emotions, and behavior, and stop you functioning well. And it's the extreme end of a normal reaction. The important thing is that if you've got someone, say they're at work and they say they think their manager is treating them very badly, and they're feeling bullied by their colleagues, that once you solve that problem, once the management problem or the colleague problem is solved, you would expect the adjustment disorder to get better by itself, usually in a matter of days or weeks, but definitely by 6 months. And long-term problems from adjustment disorders tend to occur because when someone has an adjustment disorder, they may act very out of character. So they might end up getting in the car and drunk driving. They might end up telling their boss what they think of them. They might end up making a terrible mistake when normally they're